Now I'd like to welcome our second speaker. I always mess up her last name, and I apologize in advance, so I'm going to give it my best shot. I know her as Elena, and we would like you to know her as Elena B., or Elena. Balanenkov? Balavlenkov. We're close. Thank you. I'm proud to call Elena a friend and a colleague, but in a true sense, she understands the patient journey. She's a nurse by training, and she's the dialysis facility lead in the Division of Quality Measures for the Center for Medicare and Medicare Services. She's joining us today to discuss CMS's engagement of kidney patients for assessing dialysis facility quality. And most importantly, I don't think you'll find a more active champion within CMS for kidney patients in terms of taking patients and involving them directly in the policy development and the measures that determine what kind of quality care we get. She's absolutely been fantastic, and it's a true honor to have her here today from CMS.
So the one thing I have to warn you ahead of time is I am high touch, not high tech. So it's a good thing I don't really go by my slides. So while we're waiting for my slides to come up, I'm also usually not one to use a mic. I'm a big person who likes to walk with them among the audience. So if I wander and you can't hear me, just put your hand up and I'm like, okay, dummy, get back by the mic. But, okay. Here's the big thing for me, and I had to laugh this morning because Paul is always throwing out challenges. And as I was walking over here, I walked by a sign that showed me where the pool was, another sign that showed me where the gym was, and I thought, I'm going to kill him myself if he makes me do my speech on an exercise bike, because there ain't no way that's happening, because it'd be, hi, I'm Elena, because we're not used to experiencing the challenges of life that you guys are. You guys make this work, and that's one of the reasons why we want to talk about is how not only how we have engaged with you, and I was very excited when I was walking around the vendor room that somebody mentioned that CMS has gotten better at recognizing patients, and we've gotten more sensitive at getting it right. So the thing for me is that I want to be sure that I'm talking to the right audience. And what does that mean? You all are here because you're already engaged. You're your own advocates. And so what we need to do at CMS is figure out how do we get the word out to the people that are not in this room. Your friends, the person sitting next to you in the chair in the dialysis center, the people that don't realize that transplant is an option for them, that don't realize that by doing dialysis at home, maybe it could make their life easier. So that we're going to talk about how we partner with you to improve quality. I want to talk about dialysis facility compare and star ratings, and also how we're working to improve our ability to get information to you and talk about opportunities where you can get involved. I want to thank you all for being here, but the other thing I want to thank you for ahead of time, and I've always heard that at every speech you should end with an ask. And my ask to you is look around this room and see why isn't every chair filled? Why is it that we have 200-300 people here when we have so many dialysis patients? How can CMS get to hear from the voice that we don't traditionally hear from? I love engaged patients. They keep me in line. They keep me honest. But what we are trying to figure out is how to get to the people that are not in the room, the people in rural America, the people who are not aware of even what CMS stands for or what is the service that we offer. So my ask to you is to talk to the guy next to you in the chair, or when you go into clinic, or your neighbor at church, and tell them about what you experienced here, what you learned here. I'm going around the room and meeting service providers and organizations I haven't heard of before. So what makes me able to talk to you about all this stuff? Paul will tell you, I'm one of these crazy people who will throw myself in front of a car for a patient, okay? I know what it's like to be in a hospital bed and have somebody take away, my clothing and put me in a gown. I don't have kidney disease, but I've been a nurse forever, and I've looked at it from multiple different views. I credentialed the first chronic disease center as the Center of Excellence for Joint Commission. I've worked at CMS on kidney disease since the past 8 years. I worked with all the 18 networks. My biggest success in my entire career was developing the patient contact utility because we never had a way to centralize patient concerns. And we didn't call it a complaint because people say, oh, there they go complaining again. But we talk about a grievance, okay? And looking at the issue of discharges, involuntary discharges, averted discharges, the networks work really hard for you to keep patients in the chair. We know that there are people that struggle making the management of their disease part of their daily life. And the networks work really hard to try to find places for patients that are not easy to care for. Maybe they have a lot of medical issues, or patients that, just may be concerned about the care they're providing. I also try to be a subject matter expert. By coming to these conferences, and I go to the ASN meetings and stuff, and I learn a lot of stuff there, but I learn more from people like you, because you all are our subject matter experts. And one of the things I learned was when I was at a meeting last year, someone said to me, I don't want to be called a subject matter expert anymore. I'm a patient advocate. And that's one of the things that I took back to CMS that we are trying to change, is the way that we connect with patients. So one of the things that we've done is create Dialysis Facility Compare. And just like it says, it is a way for you to compare dialysis facilities. So that not only when you're traveling, but if you have somebody in your family who has kidney disease and is newly diagnosed, that you can look at finding a dialysis center not based on just distance. But if you're in school, if you want to work, if you take care of your grandchildren, they have to make sure that they get off. So that what happens is this is an opportunity for you all to get information while sitting in your pajamas, drinking a cup of coffee, and saying, what's the best place for me? Now, the biggest thing is that the Dialysis Facility Compare site has gone through various permutations, various improvements, driven by the information that we get from you all. We meet with the advocacy groups, AAKP, Dialysis Patient Citizens, NKF. We meet with provider groups, DaVita, Fresenius, DCI, we have national provider calls. And that's one of the things we want to see more patient involvement in, so that, and I told Paul, one of the first lessons I learned today that I'm going to take back to CMS is the fact that we're not really good at marketing ourselves. That when I tell people, well, I work for CMS, well, what is CMS? I work for Medicare, well, what is Medicare? And I will tell you honestly, I was in Medicare for 5 years before I realized I was working for an insurance company. I always swore I would never work for an insurance company, and I'm working for the biggest insurance company in the world, Because I went there as a policy advocate. I went there as a patient advocate. So, you can teach an old dog new tricks. But that's the big thing is that we want to hear from you, letters, calls. You just got another government official's email. We put it up there for a reason, we honestly do. But one of the biggest things that we need people for are our focus groups, patient summits, consumer testing, technical expert panels. Because I would tell you the other thing I learned from patients that I took back to CMS 3 years ago, and I was very flattered when somebody said CMS is getting more sensitive to patients, because I heard from patients, don't ask us to approve stuff, because then you're not really interested in a patient's voice. Get us involved in creating stuff. We want to be at the table in the beginning. We don't want you to just show us something and say, how does this sound? You all are a brain trust that we need to tap into even more. And looking at TEPs, TEPs are technical expert panels, and we have a wide range of services on there. Statisticians, quality improvement people, methodologists, patients, and caregivers too, which has been really cool, is that we have to realize that in an aging population, dialysis patients may not be the only decision maker, that we need to also talk to the families that are helping with care. It's not just pediatric patients. And so I wanted to show you how our TEPs have grown. And I always used to laugh when I tried to explain this to people, that they said, well, but we have a patient on the TEP, okay? And what if that person calls out sick? Then we don't have any patient voice. Or what if you have what I call a room of 12 suits and one t-shirt? Who is going to represent that voice? Are they really going to answer your question? You say, so what do you think? Whatever you say. We need to be louder. You know, we need to have more people. And as you can see, and I was really excited on our star ratings tab, you know, we had 50% patient representation, 50% professional representation. The patient-reported outcome TEPs, look at the numbers. You know, we're finally getting it, that people want to be there at the creation, at the suggestion phase, not just at the approval phase. And I will tell you that AAKP has been really instrumental, as has Dialysis Patient Citizens, in working with us. And when we did this summit, that, you know, people partnered together to get us patients there. And the big thing is getting the patient perspective. And we learned simple things by getting people in a room. We heard from a patient at that time who couldn't get her mother into dialysis. Do you remember that? And her mother passed away before she ever was, you know, allowed to get services, because since she wasn't in the system, only certain people could help her because she really wasn't a patient in the system. You know, so it's a really complex system. And so we talked about DFC and how people can use that information. And one of the questions we asked is what is missing. And the funniest thing for me, the first thing I heard is, stop using those stupid pictures. We all look like people that are debilitated. You know, we carry briefcases, we get on trains, we serve on panels, you know, we're chefs, we're doctors, we're nurses, we're librarians. Change the image, because when you change the image, people become more interested, they become more involved. That we don't just want to see somebody in a chair and somebody standing next to them with a white coat. And so the first thing we did was go back and change all our graphics, because we hadn't thought about that. It was always stock pictures that just showed a guy in a chair with somebody standing next to them. So when we look at the information, and we found is we started doing some focus group testing. And I will tell you, one of the biggest advocates that we heard from at that time, Dialysis Patient Citizens, called us up when we did the first star ratings release and said, really, this is patient friendly? It's at a 19th grade level. It's for college graduates. You need to bring it down so that real people can read it. So we worked with different people to try to plain language things better. And so now we ask people to read this and say, does this make sense to you? Because we have people with functional illiteracy, we have people that maybe just finished high school, we have people that maybe are in college and still can't understand concept. So we use that feedback to create a more friendly site. And so you look at terms and concepts, and that's a big thing for us. And the other thing is that we have to make it more caretaker friendly. We recognize the pediatric patients and the fact that moms and dads are looking at this, but we're also heard from you all that we need to start looking at the senior patient and the caregivers that are taking care of patients that are elderly, that are frail elderly, that are involved in this. Dialysis patients need to know about star ratings. And why do you need to know about star ratings? People look at stars for restaurants. They look at stars for the car to buy, for the best shoes. And so we were asked to use a system that the consumer is familiar with that could help them understand without having to do a whole lot of reading. We're a very visual society to make something simple. So Dialysis Facility Compare has come out with star ratings based on certain mathematical scientific principles so that you can look at this and say, okay, there are 5 stars, there are 4 stars. I know what that means. So what information can you find on DFC? We're changing it from a site which years ago was only used by doctors, by researchers, by people writing newspaper articles or journal articles, to a patient-centered website. Yes, those individuals, the scientists, the academicians, can still link and drill down into the data because we need to have a central place where we can report information. But the biggest thing is getting the information out there so that you all can look at why is it that Medicare is looking at these 11 things. What is this that's important? So that you can compare 3 sites at a time. Why 3? You don't want, when you, and I'm showing how old I am. Sears, you compare washing machines, you look at 3 because we don't want to do information overload by being able to compare 5 or 10. So by limiting it to 3, you can identify if you're in school or you're working, do you want a dialysis center that offers services at night? What is close by to you? And I will tell you that CMS has been accused of being a travel agent. When we first came out with the star ratings, people kept saying, well, you're telling people that they need to move because they're only a 2-star facility. And I tell people we're not a travel agent, we're a travel insurance agent. So that what happens is we are providing you the insurance of knowing that you can look at this information and decide for yourself, as a new patient, where do you want to start your dialysis? As a patient who's moving from Kansas to Milwaukee, how to find a center, that if you are staying in a center because it's geographically close and the shift works for you, that you can talk to your dialysis staff and say, what's all this mess mean? What is my part in this and how can you help me with it? So that's an incredibly important fact. The other thing is that we hear from people that not only do they want to know if there's shifts after 5, but also some people want a large dialysis unit, some people want a small dialysis unit. And so we've tried to make this as friendly as possible. But this is my other ask to you. How many of you have ever been on the site? Can I see a show of hands? Okay, so not very many. Look around the room. We're doing something wrong, and we need to hear from you all, how do we drive more traffic to the site? How do we get people to realize that they can use this? And I will tell you, one of the things that we've looked at, and we had a focus group on this, is a lot of patients do not have computers in the home. And we worked with AAKP to get a lot of information about this, but that people are entitled to what I call assistive phones based on financial incomes and needs, so that we're looking at responsive design. We've done a study where if you are accessing this site by phone, is it going to drive you nuts because you can't read it because it's so small, or you have to click through 15 different screens to get the information that you need? Because what we've learned is that people are accessing the site through their phone, or they're going to the library and looking at stuff when they take their kids to the library to do homework. But we need to find out from you all why people aren't going to the site more. Why is it that most of the people that are going there are providers looking at their star ratings when we update the site, do our quarterly measure increases? And so, I'm here the next couple of days. If you've got any suggestions, I'll take it. So I'm just showing you a couple of the pages so that you can see. And these are actually the measures. And what was interesting is that we heard from you all the need for more patient-reported outcomes. I can't tell you how many patients have said to me, I'm not as much interested in the clinical measures because I expect if somebody's taking care of me, they're going to do a good job, and then my blood work will be good. What I want to know is how do they treat patients? Are they polite to the people? Do they provide what patients need? Because you're there so many hours a day. 3 times a week. And so we look at the fact that we have clinical outcomes that are important and are scientifically based and have been discussed with patients through various steps, but that we're also looking at trying to create more patient-reported outcomes. Patients have said to us, we want to know about an infection. My access, whether it's a fistula, which is the gold standard, or a catheter, is a great source of infection, and I don't want to end up in the hospital because somebody doesn't know what they're doing. So we report information on infection control. We have information about the patient's experience, and people can say, well, why not just KDQOL? Quality of life is different than customer service. They are both important. KDQOL is done at the facility level. At CMS, we look at the patient experience of care because this, I always say, the time that you spend in that chair is about equal to a full-time job. So that we want to be sure that you are getting what you need and that people are spending sufficient time with you and giving you information that you need so that you can manage your disease. And one of the things that I think is very exciting is now the star ratings are going to have a star rating for the first patient-reported outcome, which is the AAKP's results. Before we just reported the information, facilities were not rated on the results that they got that. And this October will be the first time that for a patient-reported outcome we have star ratings, and we also have continue the star ratings for clinical outcomes. So you'll be able to look this up online. You'll be able to look and see what patients think in that center in terms of, you know, did the doctor spend enough time with them? Did they give information? Was the center clean? Did the patient feel they were treated with respect? So these are just some of the ways, like I said, that, you know, we're looking at with you with Dialysis Facility Compare, getting ongoing feedback. Please fill out the satisfaction survey. I'm really bad about filling out surveys, but since I've become the DFC lead, I'm getting better about it because we really want to know if we are doing a good job or if we suck, frankly. You know, I've only got maybe another 5 years to work. Let me fix it before I retire. Seriously, you know, starting to get stuff right. We're not finished. Trust me, we're not finished. We're not at the end yet. So these are some of the changes we're making. We're adding new information. We're improving measures. We're coordinating more with the different kidney care groups. We're trying to improve navigation through doing testing and stuff. We've changed language. We've added the star ratings for patient experience. We've revised 4 measures. We've gotten more measures approved by NQF. So all of this is important. Making the language easier to understand. When you say the word hemodialysis, you're already at a college level, okay? Because there are so many complex medical terms. So there are still things we need to fix. People are asking about nocturnal hemodialysis. There are very few centers that offer nocturnal. And what that means is basically that you would go to the center and you'd be sleeping and getting your dialysis at night. And patients are asking for that, so we're trying to find more information for that. Patients are asking about Wi-Fi in the dialysis center because if you're there that long, you want to look up information, you want to answer your email, you might be at work and somebody needs to get in touch with you, so you need that. A lot of people are asking about cleanliness and safety. You know, it's another thing we're looking at for patient-reported outcomes. And people are asking us for the results of state surveys. That's another thing that we're looking to add. So we really do want to hear from you. We know the face of dialysis is changing. Look around this room. You know, we have school teachers, we have people that are retired, we have grandmothers, we have doctors, we have lawyers. You know, we have all different types of people. I mean, look at Paul. You know, I mean, he stands up here and says, well, yeah, I got kidney disease, but I also got this, and I got this, and I got this. We're talking about a fully integrated, rich life. And that's what you all bring to the table, and we need to hear from you all. So there's one thing that I want to tell you about before I say thank you, and this is the coolest thing ever. And I really have to thank AAKP and Aaron and Diana for this. For the first time, CMS did focus groups with people who have either no access to computers or limited access to computers. Because we need to worry about how do people get information when they're not sitting there and clicking around on things. What do you do for people who have trouble reading, who have trouble, you know, understanding things? And I will tell you, for a year, they shook the bushes to find us patients that represented the community at large. We ended up with Native Americans, we have pediatric patients, patients on PD, patients on hemo, patients who don't use the computer, patients who can only use the computer with help. Because we cannot assume, CMS cannot assume that everybody has a computer in their office and that's where they're getting information. And I will tell you, if it wasn't for these two ladies, this never would have taken place, because this was a very hard population to reach. And we had our last focus group this past Friday, or Sunday rather, because you have to do it when a dialysis center is closed. And now we're talking to pediatric patients and pediatric caregivers. And I will tell you, I can't thank AAKP enough for helping us with that, because this is a population the government has not spoken to before. So it's easy to talk to people that are engaged. It's really hard to find the people that are not engaged. And how did that come about? We were at a TEP and people said, well, what about those of us that aren't in a room? What are you doing for us? So I want to thank you for even putting that idea in our head. So I'm here the next couple of days. Shake my tree, tell me what you need, and I'll listen. Thanks so much.
Well, thank you, Elena, and I'll work on your name. But the other thing I'd like to do is recognize Elena. Several years ago, we started a recognition for those United States civil servants who make a difference. And in this day and era, sometimes it's not easy to work for the United States government. A lot of people say a lot of different things about that. We've always been quite proud of the United States Civil Service. It's in our history. They were there at the beginning of the stand-up of the ESRD program. And I have to tell you, for those folks who serve America, who go to work every single day and who think about you and your concerns, if you take a look at the body of her work and her dedication to this, Elena has been absolutely outstanding and a true champion. And today what we'd like to do is give her our National Public Service Award as a U.S. civil servant. Thank you.
You know, this means more to me than my college diploma. Seriously. Thank you all.
Before we bring up the next panel, there is one thing that we would like to do. One of our board members and one of our true champions in the kidney community, a fellow patient, recently joined us in Washington, D.C. For a number of different activities. His name is Bill Murray. And Bill Murray was able to accompany us to the White House, to Secretary Azar's office at the Department of Health and Human Services. And he was a fellow who, it was hard not to love him, and it was hard not to feel his love for us. We were quite honored to have him come to our board. And his enthusiasm and participation in kidney organizations across the United States was boundless. And his voice was booming and his spirit was large. And we lost him. And Bill was very much a happy Irish warrior in many ways. And there are many connotations to that. I'm afflicted with a few of the same. But I have to tell you that Bill embodies for us why we're here, and he's a firm reminder of why we fight. And fight is what he did, and it's what many of us do. But our staff team has put together an absolutely superb remembrance of Bill. And we're doing this because the next panel we're dedicating in his memory, it's the panel on innovation. And you will hear some of the best minds in the United States. But before we do that, I'd like to have the staff show you something that they put together for Bill. And we remember him and we remember everybody at this point in time because they are the fuel and the inspiration for what we do and what we do going forward. So, our friend Bill Murray. The Irish believe in irony, and our great hope is that in our lifetime, that all those things that we see and that are started are finished on our watch. And perhaps it's only fitting that the person who put this together, with the help of many of you in this room, her name is Erin Cayley. And that's exactly what Erin go Bragh means, Ireland forever. So perhaps it's only fitting that somebody named Erin did this. When John F. Kennedy went to Ireland in 1963 as the first Irish Catholic president of the United States, he spoke before the Irish government. And in his remarks, which were very telling for a time such as this, he quoted the Nobel Prize playwright George Bernard Shaw. And he referenced that Shaw had once, speaking as an Irishman, summed up an approach to life. And that is that other people, he said, see things and say, why? But I dream of things that never were and say, why not? That was Bill Murray, and that's our charge. And with that, I'd like to thank Erin. I'd like to thank all of the fellow ambassadors to Bill. And I'd like to dedicate this next panel on innovation, because the people that you were here are in the fight, and they're in the fight to change things and to rock and change the status quo of care in the United States. And that's the best way to remember somebody like Bill and so many of those folks that we've known throughout the years, a true inspiration.